We are talking endometriosis symptoms and giving you some root cause solutions today. I'm Dr. Jolene Brighten, and we're going to have a Q&A session, but I want to chat for just a minute about what is endometriosis and what are the signs and symptoms of endometriosis. Now, I want to say hi to my Instagram people who are coming on and hello to my YouTube live people. We are going to do some Q&A at the end. If you didn't know, this is March. It is Endometriosis Awareness Month and is a very important condition to raise awareness around because 1 in 10 women have endometriosis, and I would say 10 out of 10 women have been dismissed by their doctor. So what does that mean? Well, you go to your doctor with signs and symptoms of endometriosis, and the first thing is you're usually told, oh, girl, just take the pill. Here's a painkiller. Periods are meant to be painful, and that's just the way it is. In fact, women go for years struggling in this loop with doctors dismissing their symptoms and trying to suppress them with medication without getting to the root cause of what is going on. And that's something that, sometimes we use the pill or any other form of hormonal contraceptive for women with endometriosis, but never without asking why. Why does she have these symptoms? So let's talk about the symptoms of endometriosis, what it might look like for you. Now, as you're coming on and you're saying hello, if you do have endometriosis, please share with me what your symptoms and your experience has been. I would love to hear from you. I'm sure other women who are on here with us right now would love to hear from you as well. So the most common symptoms of endometriosis really they revolve around pain. So premenstrual cramps or menstrual cramps that are incredibly painful. Now, you'll sometimes hear, people will say, oh yeah, it's just like a really painful period. No, endometriosis cramps, they are debilitating and they can last, the entire period or even come on before then. So some women are having pain 10 plus days out of the month. It's not the kind of pain where you just pop a Midol and it goes away. Usually that barely takes the edge off. You're hugging a hot water bottle, and this pain can bring women to vomiting. There also can be pain with sex, what's called dyspareunia. And that pain with intercourse can be due to adhesion. So with endometriosis, we have the endometrial tissue, which is the lining of the uterus. It can travel around and implant in other places. And then as you bleed, your body tries to protect you. You start getting adhesions, so like connective tissue building up. And that can cause issues really anywhere in the body. We think about the pelvis, but also in the gut as well. So with endometriosis, pain is something that we're seeing as a common theme. Pain with periods, pain with sex, and pain with bowel movements as well. So if you are a woman who has pain with urination or defecation, that's a fancy way of saying pooping, it's worth investigating. Do you potentially have endometriosis? Because with endometriosis, those adhesions can be in the bowels as well. And I see Kat is saying that after a decade, she was diagnosed with stage 4 endo and based on the blood work, lost her ovary and had infected hemorrhagic cysts. I'm so sorry to hear that. And that can be one of those long-term issues that come out of having endometriosis dismissed and not investigated. So thank you for sharing that, Kat. So we can have pain with bowel movements, pain with urination, pain in the abdomen, pain in your low back, pain in your thighs. Do you ever get menstrual cramps and it radiates down your thighs? That could be signs of other things, but it may very well be endometriosis. Now, the other factor that we can see is heavy periods. So women with endo can have heavy periods as well. I see some of you are jumping on saying that you had pain and GI distress and not really bleeding symptoms. And so you're going to catch on to a theme here is that it doesn't always look the same for every single woman. It can really vary how these symptoms present. And that's the thing about medicine is it likes to have medicine's like, here's an algorithm and here's exactly how everybody presents. But reality is almost nobody presents like the textbook tells us they will. And so really partnering with the doctor who's willing to listen to your story is where it's at. So with that, we're talking endometriosis and some of the symptoms. Now, the other symptom of endometriosis can be difficulty becoming pregnant. And as I talk about in my book, Beyond the Pill, Endometriosis is estimated to be over 10% of the cases of infertility. And this is a big problem. When a young woman presents with period pain, we pass her hormonal birth control and we don't have any discussion about what might be going on, or at least mentioning, hey, this could be an issue with endometriosis. Like, how do we diagnose endometriosis? Well, the gold standard is a surgery. So, actually operating on the pelvis, albeit minimally invasive compared to other surgeries, it's still surgery. Nobody really wants to operate on a 14, 15, 16-year-old girl's pelvis. We don't want to operate on young women. So with that, if we pass a woman hormonal birth control saying this is the key and the solution to your period problems, we should also have the discussion that, if this period pain persists, we should investigate endometriosis. This is something that you might want to investigate in the future, and making sure that she's aware that that's a possibility. So what about using hormonal birth control for endometriosis? So here's the thing. He wrote this book, Beyond the Pill. And there's people who have, gotten it in their mind that I'm somehow anti-birth control. And this is not true. I am not anti-birth control. And really, with birth control, it's a situation where sometimes that can get a woman out of pain, and so that she can work on the root cause of endometriosis. So we need a whole lot more research on endometriosis, but what we've come to understand, it's an inflammatory condition, likely rooted in autoimmunity and gut dysbiosis, like just about everything it seems these days. But with that, there is a hormonal component as well. So estrogen is one of those hormones that can influence immune system regulation, and estrogen dominance that can make your immune system get all hot and bothered, but also overstimulate endometrial tissue anywhere in the body to proliferate. And so with that, we need to be investigating what's going on, and we need to be addressing that. But at the same time, it may be something where you pass a woman hormonal birth control with full acknowledgement that this is for symptom management, not actually a root cause solution, so that she can get out of pain, so she can do that root cause work of, eating well and moving her body, and all the things that it takes to heal, like root cause, that is like, it takes energy. And if you are writhing in pain and you can barely move, you're not going to have the energy to do that. So for those of you who are jumping on and joining us, we've been talking about endometriosis, signs and symptoms. I see Serena here is saying that she was given birth control at 16. She still has serious period pain, but no doctor wanted to look into it. And that is all too common, because the thing is that that's about what they've got in their toolkit. And so this is a big problem. This is a big reason why endometriosis isn't getting recognized. And it's also an issue that we have to understand that doctors, there is a well-documented phenomenon known as medical gender bias. That is, your doctor steps into the room with a bias already that goes like this. If you are a doctor, I'm not bagging on you, but there is research showing that women are more likely to have their pain dismissed and to receive inadequate treatment. So they actually don't get treated correctly just by way of having a vagina. Like, hi, as I'm talking to you right now, it's 2019. How is this still a thing? So we've been talking about endometriosis symptoms. We've been talking a little bit about the root cause. I explained to you that there's the estrogen dominance component of endometriosis, that the research that's coming out is showing us that it's likely rooted in autoimmunity. So that's gut. The gut is unhealthy. We've got intestinal hyperpermeability or leaky gut. We probably have organisms that shouldn't be there that are there, growing in the gut, and a family history. So genetics that are playing a role in all of this. And we're starting to see more and more that environmental toxins are involved in all this as well. Not a big shocker, right? I'm sure nobody's surprised by that. So the reality is we're not entirely sure what causes endometriosis, but there's been a lot of experts that have begun questioning the role of environmental toxins. So chemicals like dioxins and PCBs, they're thought to increase the risk of endometriosis. And they do this by altering cytokines. Those are chemical messengers of the immune system. Think of them more like hormones of the immune system. And those chemicals will also alter immune function. They absolutely alter your hormones altogether, and other growth factors that can lead you to creating more of these adhesions. Now, the other thing that's really important to consider with environmental toxins is they impact your liver function. So as we talk about the estrogen component with endometriosis, we also have to recognize that the way that you process your estrogen plays a really big role in how things grow in your body. So as I talk about in the the liver chapter in Beyond the Pill, which is chapter 5, your liver is really responsible for making estrogen metabolites, and it can make the nice, safe, yummy, wonderful, loves up your body 2-hydroxyestrone, or it can put it into the 4-hydroxy or the 16-hydroxy pathway. Now, the 16-hydroxy pathway, and you'll see this on the lab, it's 16-OHE1. That one in particular, now 4 is not awesome either, but 16 causes things to grow, and so it stimulates growth. So for anybody who is asking about endometriosis, cysts in your ovaries, adenomyosis, fibrocystic breasts, and cysts in your breast. Can I get these words out? With that, you definitely want to look at that liver chapter, so chapter 5 and Beyond the Pill, because that takes you through how to get your liver processing your estrogen correctly. And it's entirely possible that you have, on your blood work, it looks like you have low estrogen, but in reality, when we test metabolites using something like a Dutch test, we see that those metabolites are, you're making the wrong kind and stimulating growth. And so that's another place where if environmental toxins are bogging down your liver, then we're going to see issues in terms of your estrogen altogether. And, you know, your liver is like everything in your health. And we're going to have to do a whole like liver chat time. That's going to come in the future. So talking about endometriosis, we've covered the symptoms women have. We've talked a bit about the root cause. We've talked about the issues with doctors who just don't listen or dismiss women's symptoms. So with that, never stop advocating for yourself. If you think that something's not normal, you're the only person who lives in your body, which means that you're the only one that has a barometer on what is normal. And I also want to frame, this is a conversation that I bring up a lot, and it's very, very important for all of us to recognize that when people see a doctor, they're usually sick and they have symptoms. So when they go to their doctor, they're like, I'm having terribly painful periods. I'm having extreme PMS. Like, I'm constipated. I'm having pain with poop or pain with urination or pain with intercourse. And their doctor gets to hear those stories all day, every day. And that can lead your doctor to say, this is normal because I'm hearing about it all the time. It must be normal, but it's not normal. It's common. And we have basically a population they put themselves through their own funnel that when they come to our practice. So for instance, I diagnose a lot of Hashimoto's. Yes, it's very common, but it doesn't mean that it's normal just because I see it all the time. And so keep this in mind. You must always advocate for yourself. And as we talk about endometriosis, that's definitely one of the areas where that's a condition you have to advocate for yourself. And being a woman, you really we go through on average like 5 doctors before one of them listens. So, and some of you are popping on saying that you were given antidepressants, and this is not uncommon for women to be given antidepressants, anti-anxiety medication, be sent to a counselor and be told, oh, you're just being you're being high maintenance. We'll hear that sometimes. Or, you're overly worried. You're a hypochondriac. The word hysteria, like where that was born from, and that still gets thrown around in medicine. You're not, it's not in your head. You're not hysterical. If something's not right in your body, you have to advocate for yourself. Now, let's talk about what are some solutions for endometriosis. And I want to be really clear here because there are people who talk about endometriosis and they'll start talking about solutions and they're like, oh, just change your diet and your endo will get all better. That is one piece. When it comes to endometriosis and all chronic disease, you have to take a multifactorial approach. And with endometriosis, I always advocate with my patients, they need to have a healthcare team. So you do need to have that counselor in play or somebody who's supporting your mental, emotional health, because women or people in general with chronic pain, they tend to be at higher risk of depression, anxiety. Like if you're in pain and you can't even poop without being in pain and you got to poop every day to get your estrogen out, that's going to weigh on your psychological health. So that's one team member that you need to have. If you're going to change your diet, having a registered dietitian or a certified nutrition practitioner, I think, is a wonderful adjunctive provider to help support you on your journey. A massage therapist who can work on adhesions is also highly, highly beneficial. And especially when we get into pain, the body will start shifting and changing in a way to safeguard us against pain. So having a physical therapist, personal trainer, and massage therapist can be highly, highly beneficial. You want to have a good surgeon. So even if you're not having surgery now, you want to spend your time investigating a surgeon, finding somebody that you can partner with so that if it comes down to that, you've already got a relationship and that you can move into that seamlessly. And someone with endometriosis need to have surgery. There's no shame in that, okay? There's no shame in doing whatever you can to feel amazing in your body. And whether that's using hormonal birth control temporarily, that is, getting surgery done, that is, making sure that you have some other support networks in your life, whatever it takes for you to feel whole in your body and be able to enjoy your life, more power to you. So we need to have a healthcare team. Now, if we do know that endometriosis, some of the main symptoms is pain, 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 then we've got to look at ways to get women out of pain. Like I said, if you are in a ton of pain and we're like, hey, can you eat well and exercise and make all your food? You're going to be like, no, I can't do that. So one thing, when it comes to pain is that we can consider using melatonin. Now, I teach you in Beyond the Pill how to bump your melatonin naturally and make sure that we're supporting that. Now, melatonin has been shown to be helpful, but in addition to that, melatonin is also something that can help with protecting you against things like breast cancer, keeping your ovaries healthy. So melatonin is an antioxidant. Although it helps us sleep, it's also an antioxidant. And so with that, generally in my clinic, we start with around 3 milligrams of melatonin. This is something that's in my Sweet Dreams formulation, which also has the Sweet Dreams formulation has in it nutrients to help nourish the parasympathetic nervous system, which gets you out of fight or flight and supports you being in the rest and digest. And there's a question here, can melatonin help boost serotonin and GABA also? No. So the pathway, you take tryptophan and you convert that into serotonin. Serotonin is then converted into melatonin. And so, serotonin is going to help you make melatonin. If we want to stimulate GABA, we want to get our progesterone levels up, which means we want to be ovulating regularly. So great question there. So melatonin is one thing that the research has shown it can help reduce menstrual pain, pain with sex, pain with urination, and pain with bowel movements. All that stuff we just talked about. Yay! So you can boost your melatonin naturally by wearing amber glasses. And I will come in and share a link with you guys with the amber glasses that I love. They're tested. They're highly effective. And I talk about them in Beyond the Pill as well. Sleeping in a completely dark room, eating foods like pineapples, bananas, oranges can help increase melatonin levels, getting part of how we convert tryptophan into melatonin in that metabolic pathway. And the other piece of that with the magnesium is that magnesium can help reduce pain as well. And it can help with you processing out your estrogen, so avoiding estrogen dominance. Now, the other thing you need to create melatonin is B6. So getting a quality B complex every day, it's very rare that I recommend. Actually, I never recommend taking one B vitamin alone. If someone has like a B12 deficiency, we're going to bring in a B complex plus added like sublingual B12. And the reason for that is that as you increase your B vitamins, if you increase just one, you can ramp up part of a metabolic pathway, and you start using up other B vitamins, but you're not replenishing them and you're not replacing them. And so that can be a bit of an issue there. We've got to make sure that we are making sure that we are feeding the entire pathways. And I see questions coming in about what brand. So at drbrighten.com, you will find the supplements that I use within my clinical practice. And so that is, so we talked about the Sweet Dreams, there is the B Active Plus, and then there's the Magnesium Plus. Those are the 3 supplements that I use in my clinic that I just covered. And I see all the hearts coming through. I'm glad that was very helpful for you. Thank you both, my YouTube people and my Instagram people, for being here with me live as we record this information on endometriosis symptoms and root cause solutions. So when I'm talking about like how to get out of pain, that's not generally a root cause solution, but it's a very necessary part. As you read in Beyond the Pill, and you'll find all over my website, in my online programs as well, I'm all about how do we make you feel better as soon as possible while we also work on the root cause. And part of that with endometriosis is getting you out of pain. So I just gave you a few tips for getting out of pain, but I want to talk a little bit more about the root cause. So with the root cause of endometriosis, again, we need a lot more research. That's why in March, we are advocating for endometriosis awareness. There's not enough funding going into women's health research. It's a slap in the face in terms of not being respected by medicine, and it's time for that to change. And that is why we need more research on endometriosis, because we just don't know enough, and that ain't right. Like, why do we know so much about diabetes? But we don't know so much about endometriosis and polycystic ovarian syndrome and birth control side effects and all of these things. And it's because like these are lady part problems that get kind of brushed to the side. And we sometimes hear from doctors who are like, women are too complicated. Hormones are too complicated to figure it out. And as if we're too dumb to understand our menstrual cycle. I reject that wholeheartedly. I have never met a woman who was too dumb to know her menstrual cycle. That is ridiculous. In fact, like women are very tuned into their body, and it is very much something that like if you teach them and that how to manage or how to track their symptoms, they can start troubleshooting and figuring out things right away. Okay, so back to talking about the root cause of endometriosis. So if one thing is that we suspect that it is autoimmune, then something that we can do is start shifting the diet and healing the gut. Now, I started off, saying as we were going to go into these root cause solutions that, hey, with that in mind, know that you can't just change your diet alone. But it's a super, 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 super important piece of the puzzle. And I just want to say that because with endometriosis, it's something that sometimes I see people that'll say, like, just change your diet and everything will be fine. And changing your diet is very important. It's absolutely necessary, but I don't want you to feel frustrated or like you did something wrong if you change your diet and then everything's not just fine. For as long as you've had symptoms, so this is what I tell my patients to gauge it. So if you've had symptoms, let's say you've had symptoms for 12 years, we can expect 12 months of you really dialing in your diet, your lifestyle, supplements, like the whole works, to start to see resolution of what is going on. Does it mean it will take you 12 months to feel better? Absolutely not. But it's a good, mindset practice to be realistic on what it takes to heal the body naturally, because it's not like using a pharmaceutical. A pharmaceutical comes in and is like, you're doing it wrong, body. Shut it down. Push it over here. Like it basically makes your body submit. And when you're using natural therapies, you're working with your body, and it's like it's a dance, okay? And you're trying to lead, but sometimes your body's going to lead, and you have to start working with your intuition as well to know, what is true for you, but also like when it is time to rest and when it is time to move forward and when it is time to change things. And so I say all of that not for you to be like, oh my God, I have to take so much responsibility. Yes, you do. However, you get to take so much responsibility and you have the power to heal yourself. Now, let's talk about diet a little bit. Now, endometriosis does have an inflammatory component. And so with that, we generally recommend an anti-inflammatory diet to start. And then I couple it with something like, my gut healing supplements as well. So like the gut rebuild. So we start rebuilding the gut, bringing in a high quality probiotic, which I see you guys already asking. You can find that at drbrighten.com as well. And we want to often investigate doing a stool culture, doing testing, maybe small intestinal bacterial overgrowth testing as well, to understand, is something growing in your gut that doesn't belong there? Because we have to heal the gut. It's where the majority of your immune system lives. And if endometriosis is inflammatory, there's immune system involvement. So when it comes to an anti-inflammatory diet, yes, I see some of you saying gluten-free, paleo, dairy-free, anti-inflammatory diet. Yes. So We want to take out gluten. We want to take out dairy. We want to take out things like nightshades. Does that mean that like you can't ever eat a tomato again? No, but you have to test what is true for you. And nightshades, like potatoes, eggplant, peppers, tomatoes, which by the way, I will fully out myself. Like my stress food, like if I am stressed, I want to eat salsa or I want to eat padron peppers. I'm always like, I was just out with a friend and I got really excited at a Mexican food restaurant because they had a flight of salsas. And I was like, shut up. How many salsas can I eat at once? And he's fun. Like he's Cuban and I grew up in the back of a Mexican food restaurant. My grandmother is Mexican. And so he was like, I'm going to eat like, you know, the tomatillo. And I was like, give me all the habaneros. So I just want to say, like, if you're like, wait a minute, I don't want to give up nightshades. I feel you. And I personally do an autoimmune paleo reset every year because I have autoimmune disease as well. And I'm constantly testing. A great resource for that is Nikki Trescott's book. I will provide a link for you. Nikki Trescott's book on autoimmune paleo is an excellent cookbook. Whenever it's time for us to do an autoimmune paleo reset, I'm like, I'm just going to go to that book. I'm going to use that. That's going to be so easy to do. So there are foods that we want to cut out. We also want to cut out soy, especially if we've got a condition that has estrogen issues going on and maybe autoimmune. Soy is often not our friend in that. And if you do ever want to reintroduce soy, non-GMO, organic soy, and slow your roll if you're going to eat it in everything because it lives in everything as that is. So with that, we want to, so there's foods we want to take out, but I'm going to be real with you here. I do not like to focus on taking out foods. So as you'll read in Beyond the Pill, my focus is always building nutrient dense diet. So we want to focus on as many nutrient dense foods as possible to bring in. And in that way, we basically crowd out the foods that aren't serving us. So, you know, if you're someone who loves to eat potato chips and now you're going for carrot sticks, this is just an example, and you're like you're like, oh, I'm going to opt for carrot sticks again. It's not that you're saying potato chips are bad or doing any of that like psychological stuff to yourself of like food is bad. Instead, you're saying, you know what, I'm opting for more nutrient dense foods. And as you do that, you just start crowding out that other stuff. And so carrots are awesome. They support liver detoxification. Broccoli, cauliflower, cruciferous vegetables. Basically, if you are a woman, well, if you're a man too, but I work with women. I'm a women's health endocrinologist. Like that's what I do, women's hormones. You want to eat as many greens as possible every single day. Can you get 6 servings of vegetables a day? And if you hear that and you're like, yo, you're crazy. That's a lot of vegetables. Here's how to start it. You add 1 serving of vegetables to your diet every single day for a week. Now, the next week, an additional serving until you get to 6 to 9 servings of vegetables a day. And it sounds like a lot at first, but if you go slow with it, you're going to find that it's like actually really easy to achieve. You also need to bring vegetables in for your breakfast if you want to get there with all those servings. And I remember back when I was getting my nutrition degree and the teachers would always ask, they'd be like, oh, who's like had this many servings of vegetables? And I would like always have my hands up with the most servings of vegetables. And they're like, how do you do that? My breakfast is always full of vegetables. So not always. Let's not try to front like I'm perfect. I'm not perfect. Okay. And I travel a lot. So sometimes I'm like, okay, I'm eating a meat bar for breakfast. That sometimes happens. I'm going to admit it. I don't want to like sit here in front like I'm perfect. But with if you start with getting breakfast going with vegetables, if you can get 1 to 2 servings of vegetables in your breakfast, like that kind of sets the stage for the whole day and makes it so much easier. And if you go slow and add vegetables like to your diet, let me say this, very, very few people are successful with making dietary changes when they just change everything overnight. So make sure that you're adding in vegetables and do it in a way, if you're not eating any vegetables, 1 serving every day for a week, then you're 2 servings every day and you just start increasing it. It'll take you 21 days to make some stuff stick, but it can take some people 8 weeks or more, 3 months to really make a habit change. Be gentle with yourself and always remind yourself of why you were doing this. And if you can track your symptoms, you will reinforce why you're doing this. So if you track where you're at, then you start implementing changes, you're going to be like, oh, this is good stuff. So dietary changes, absolutely. Bringing in things like turmeric into your diet. So if you ever are on my Instagram stories, you see I sneak turmeric into everything: garlic, onions, cruciferous vegetables, fermented foods, all of these things that can really, really help support your hormones and metabolizing them, but also support the immune system by way of supporting your intestines and your intestinal health and supporting those good gut bugs. So I could talk forever about solutions for endometriosis. I definitely detail in Beyond the Pill a ton of ways to optimize your hormones. So if you're curious about Beyond the Pill, it's called Beyond the Pill because it's meant to give you root cause solutions beyond hormonal birth control. But if you do choose to use hormonal birth control, then I want to make sure I support you in that you have all the information you need and that you know exactly how to track, monitor, and care for your body. And then it's also called Beyond the Pill so that you can know that there's life beyond the pill and that you don't have to just stay with hormonal birth control. And I see the questions coming in about, like, is this book just about the pill? Absolutely not. So understand, I'm going to talk about progestins in there. So if you done the Depo shot or had a hormonal IUD, that is going to be a consideration with progestins. And understand the pill, first on the scene, the most research. We're talking about all hormonal birth control, all things lady parts in that book. So let's jump into some questions. Let's do some Q&A. I've been talking here for a bit about endometriosis, the signs, the symptoms, root cause, considerations, and how to address those things, how to get out of pain. Now I want to hear from you and make sure that I am supporting you as well. Is the book for SIBO after the pill? So in Beyond the Pill, I do talk about small intestinal bacterial overgrowth. I will do a whole session on SIBO and hormonal birth control and hormones and for now, just know this, that hormonal birth control impacts your motility. It can impact your hydrochloric acid, your gallbladder function. All of those can lead you more susceptible to small intestinal bacterial overgrowth, more commonly known as SIBO. Is it possible to have endo with low estrogen? I had high estrogen and then came off the pill and now it's low. So if you were on the pill, you weren't making estrogen because the pill suppresses brain ovarian communication. That's not your estrogen that you're making. If your estrogen's low now, so if your estrogen is low, you always need to take a look at FSH and LH. Those are brain hormones that tell you about how it's indirect of how the ovaries are functioning. Then you look at ovarian function with progesterone. As I outline in Beyond the Pill, I give you all these labs that you should be asking your doctor for and getting support with. But with that, you guys are cute. You are beyond amazing. That is hilarious. Thank you for that. But when you have low estrogen, remember to follow up with testing the metabolites. And if you missed that, go back, rewind, listen to the beginning of this. But in addition, I would also say to you that, getting a Dutch test can be really helpful. That's something I run in endometriosis. Is chronic ovulation pain potentially endometriosis? That's a possibility. So it is a possibility, but it could be Mittelschmerz, which is some women feel ovulation. I talk about this in Beyond the Pill. I think it's kind of cool that when you ovulate, like you actually feel it, but it can be painful. And there have been some studies to show that magnesium can be beneficial in supporting that. You can go to drbrighten.com, search Magnesium Plus. That's what we use in my clinic. What's my opinion? Oh, so many questions coming in. What is my opinion on intermittent fasting to reduce inflammation and reduce flare-ups of endometriosis? That can be helpful. And so there is, so with intermittent fasting, that can be helpful with pain and inflammation, and it works really well for some people. I talk about that in the Reverse the Metabolic Mayhem chapter of my book, Beyond the Pill. And so I typically tell people start with a 12-hour fast, and that is close the kitchen down at 7 p.m. You don't eat anymore. You wake up the next morning. You don't eat again until 7 a.m. And then see how you go with 14 hours and monitor your symptoms to know if this is right for you. It actually can work really well. But if you're someone who wakes up in the middle of the night and let's say you wake up, you're hot, you're sweaty, you're like, I'm having a hot flash, but I also feel a little bit anxious. That could be blood sugar metabolism issues in which you would actually be someone who does better to eat a little bit before bed. And so In Beyond the Pill, I have an upgraded golden milk. That's something I typically will give to patients like an hour before bed so that we can help with keeping their blood sugar stable throughout the night. The other thing is that I will be bringing on a guest to do an interview in the future about the fasting mimicking diet, because that has shown tremendous benefits in reversing autoimmune disease. It's only about 20 to 30% in the equation. So you still have to be doing all this root cause stuff we're talking about. But I want to bring on an expert to share that information with you so you can have access to that. And if endometriosis is in fact autoimmune, this may be a therapy that shows promise in the future. Can adhesions go away without surgery? Thank you, Serena, for that question. So typically, we say like, we need to have surgery for adhesions. However, the body can resorb tissues. So, excuse me, where'd my voice go there for a second? So the body can resorb tissues. That means that the body can break things down and start absorbing it. Read about castor oil packs in Beyond the Pill. That is something that some of my patients have used that we've found really beneficial. There's also other modalities like working with someone who is an adhesion massage therapist that can be beneficial. It's the same thing with like fibroids and cysts. Sometimes fibroids, they get so large that we're like, we need to operate. I've had patients that are like, no, thank you. I'm going to continue to try to use these natural therapies, and they have shrunk and reduced their fibroids. And so the body is capable of so many things we don't even understand yet. That's why I like being in medicine, because we're learning every single day. So thank you for that question. So yeah, you are so welcome for the information. Thank you guys for saying thank you. I appreciate the gratitude. You think you have endo, so sign ad crilly. I think I have endo and want to come off the pill, but worried about pain coming back. Would you recommend going to the doctor before coming off, or only after stopping if pain comes back? Currently reading the book. Okay, so you're going to get into chapter 11 and 12 in Beyond the Pill, and you're going to see that like I recommend prepping your body first. So with endometriosis, this is a great question and perfect thing to be addressing. So with endometriosis, if you are on hormonal birth control and you want to come off, you want to prep your body a good 3 to 6 months. So that way you're as successful as possible. I recommend the program in Beyond the Pill, but I also recommend for women with endometriosis, my birth control hormone reset program, which is an online program to really help support you. So it's built to go along with Beyond the Pill. And you get an email every single day for 5 weeks, so you know you're right on track. When you're in that program, you're in that program for life. So most women go back, they do it again and again. We're helping you test things. You're getting even more recipes, a lot of Q&A sessions where like I've taken the most commonly asked questions and I'm filling in all of those answers for you. And with that, we've had women in the program with endometriosis. They are using Beyond the Pill. They read the book so they know the why, the how, and they get into it. Then they get into the online program, the birth control hormone reset, is just like, let's get in, let's work, let's do this. Let's teach you how to reverse all this business. And so typically with endometriosis, women come into that program, they do it for 5 weeks. They're testing things out. And then from there, if they're still on birth control, they figure out like how to support their body. And then somewhere like 3 to 6 months later, they transition off. They go back through a whole detox session again, and they basically repeat the 5-week program in its entirety. So that way they're as successful as possible. That's what I've seen being the most successful for women with endometriosis. And anytime you're concerned, definitely chatting with your doctor, having an appointment with your doctor. It may be something too that like you go to your doctor and you're like, I'm going to come off of hormonal birth control and I need a prescription for pain meds. Like I need to have, a prescription to support me through this, because you may very well have to use pain meds. No, those don't do any favor with like liver health and other things, but it's a tool, right? And if we've got that tool and we need to leverage it, then so be it. And then make sure that you can support yourself through that. So right now I'm taking questions about endometriosis and chatting with you guys. We've been talking about the signs, the symptoms, root cause solutions, some dietary considerations, ways to get out of pain. If you missed it, go back, rewind, listen again. Let's see, I'm just scrolling through, seeing if we have any more endo questions. I'm going to take one more endometriosis question here, and then I'm going to jump off. I see PCOS questions. Go to drbrighten.com, search PCOS. You'll find a ton of information on that. And so the last thing I want to say about endometriosis is that if you suspect that you have it, meeting with the doctor is crucial to get that diagnosis. And the gold standard of that diagnosis is going to be a surgical procedure. And with that, you need to understand that they often will remove the adhesions while they're in there. It's just like if we're in there now, let's just go ahead and take care of that. But if it's something where you're like, I would rather have a repeat surgery, or I want to be informed about what you find. And, if you are like, I'm a little bit apprehensive about this, talk to your doctor about it. This is a conversation that they should be having with you. So I am going to say goodbye to my YouTube people. If you are catching this later, please leave me comments, suggestions. If you have questions, we can always record another video for you and help you get the information that you need. Thank you so much for being here. I'm Dr. Jolene Brighten. I'm the author of Beyond the Pill, and I so appreciate you tuning in.